Hello everyone, my name is Karina Carcamo and today I'm going to speak about a clinical application. So in this clinical application, it is a patient who has an isolated injury in both the motor and sensory branches of the sciatic nerve. So hypothetically, let's say a medical professional gave a intramuscular injection in the gluteal region and accidentally damaged the sciatic nerve, both motor and sensory, which is very common and can happen. And there's other different ways that this can happen as well, but this is an example. So the sciatica nerve damage is very painful. First of all, there's lots of different sensations with that can go throughout the whole lower body. So you have your lower back, your glutes, the legs, and all the way up to your feet. These symptoms can also go through specifically, it goes through the posterior aspect of the thigh and the posterior lateral sides of the legs and the lateral part of the foot. So you heard lateral. What about the medial side? So in fact, medial, it does not get involved. So the medial side of the leg and foot, that is okay and functional. You feel that, you can move that. There's not much pain in that area. And other symptoms that one can feel are weak flexion of the knee, and this is motor. Also, the hamstrings can be paralyzed if it's really damaged a lot. And also, this is all due to the femoral nerve. And one other thing that can happen is a foot drop, which this means that the plantar flexion of the foot is always at all times. And this is because of the weight that's been caused by the sciatic nerve damage. And then sensory, you have the loss of the sensation of those areas, such as the knee or the leg. And just remember, the medial part is the only one that's not affected. And that's about it. If now that's what happens with the sciatica nerve damage. However, if a medical professional wants to test if a client has this and they need a physical examination, you can lie them on their bed in a supine position and lift one of their legs up, and if it reaches up to 60 degrees of hip flexion, then they have a positive if there's pain. Another thing, some type of effects that can happen to the client who does have a sciatica, they can't do as much physical activities as they did before because of the pain that arises from it. So they won't be as flexible because they can't move their legs so much to a certain degree. So gymnastics, or if they play a sport such as soccer, you don't want to damage more of those areas, so you have to take care of yourself. And that's about it. That was a clinical application for today. I hope you guys enjoyed.